Ladies and gentlemen, our topic today is a very important topic as regard to females, which is breast tumors and breast cancer. This subject usually frightens females, but my message to our females that this subject is not a frightening one today because of the advances in the early diagnosis and even the treatment without the amputation of their breasts. But there is no definite etiological factor against breast carcinoma, but we find that there is a genetic background. And this is very important, that families that had a breast carcinoma should be put in under microscope. That means this is very important to follow up families to pick up cases early with breast tumors. But what is important nowadays is early diagnosis. And the early diagnosis is dependent mainly by a very simple procedure which is very cheap and it can be learned by any female, which is breast self-examination. We have to advise females that has no risk of breast carcinoma that they feel their breast during taking a shower by their hands, which is flat. They put the finger together and the palm and feel their breasts. The right hand feels the left breast and the left hand feels the right breast, squeezing the breast tissue against the chest wall. If they feel any lump or a tumor-like mass, they have to visit their physician or a surgeon to reveal the possibility of a breast tumor. But my message to our sisters and mothers, not to be frightened, because the majority of breast tumors are benign and innocent. But what is the symptom of a breast carcinoma, which is very important? Usually females accidentally discover a tumor-like mass in the breast during taking a shower, accidentally, and they become frightened and go rapidly to doctors to hear, is this a carcinoma or not? This is one of the symptoms, presenting symptoms of breast tumors. The second is nipple discharge. Usually there is no nipple discharge away from after delivery and lactation. But if females see during squeezing the nipple that there is a discharge from the nipple, this is very important, especially if discharge is bloody. And specifically if the discharge is coming from a single orifice, from the nipple. The nipple has usually 18 to 20 holes in the nipple for milk to come out. If one of these 18 orifices discharge, bloody discharge, and only and constant from such a hole, this is a very important, and they should visit their surgeons. Another symptomatology for breast, which is very common, is pain. And usually pain is localized to one sector of the breast, or bilaterally or unilaterally. And sometimes patients feels pain which is so severe that it radiates to the shoulder. And if it radiates to the left shoulder and the left arm, they may think, or their doctors, of something happened in their hearts, or it is anginal attacks. So the symptomatology of breast disease are either a lump or nipple discharge or pain. But in the majority of breast tumors, there is no pain unless it is associated with a very common disease called fibroadenosis, Fibroadenosis is a benign disease, usually affecting females, either from 20 to 30 or perimenopausal, where they feel pain and sometimes lump and nipple discharge. And usually their discharge is yellowish or greenish and rarely bloody. So this benign disease is very common to the degree it may be associated with another lump, which is a carcinoma. And from this point, this is very important that even patients with pain in the breast, premenstrual, which is cyclic, should take the advice of a surgeon to rule out the possibility of an associated tumors. So, breast self-examination is the solution of early detection of breast carcinoma. Females usually afraid to palpate the breast to avoid the palpation of a lump. This is wrong. It is very important to adopt this breast self-examination every 3 months or every month for high-risk females. I mean by high-risk females, females where their families has a breast carcinoma in the mother or in the grandmother. This is very important. What are the methods of investigation available to reveal the presence or absence of a breast tumor or a breast carcinoma? There is no doubt that what is called the mammography or soft tissue X-ray in the breast usually diagnose the presence of a lump, and the presence of microcalcification in the lump raises the possibility of malignancy. But also, mammography alone is not enough. We have to complete it by the presence of a breast ultrasound, because breast ultrasound usually differentiate between solid and cystic swellings. My message to females who accidentally discover a lump in the breast, that if they adopt breast self-examination every month or every 2 months or 3 months, and they did not feel any lump, and over a night they develop a lump, my diagnosis is a breast cyst, usually grown over a night. So they become not frightened because it will be a cyst. Just to do a mammography and the breast ultrasound, it will solve the problem. The question whether the tumor marker can diagnose breast carcinoma or not. It is not a diagnostic aid to do a tumor marker for patients not suffering from anything, or even there is a breast lump, because the diagnostic modality of these cases is number 1 mammography ultrasound, and number 2 is tissue diagnosis. We have to diagnose these cases by either needle biopsy or during surgery by what is called frozen section. So the diagnosis by tumor marker is usually post-operative to follow up these cases for early detection of recurrence, and recurrences may occur locally or distantly in the liver or in the lung. So the treatment of breast carcinoma is number 1 by surgery, whether removal of the breast or nowadays we adopt the breast conserving surgery, and another target which is systemic control by chemotherapy and hormonal therapy. So locally surgery and radiotherapy, and systemically chemotherapy and hormonal therapy. We advise our patients in Ramadan who are taking chemotherapy or they are under radiotherapy not to fast Ramadan, because it is they become fatigued, vomiting, nausea associating the therapy. So we advise them to postpone fasting after they finish chemotherapy and radiotherapy. Thank you.